Pyzik. She's a lecturer and global health advisor at the UCL School of Pharmacy in London. She joins us from Cornwall in the UK. So we see these breakthrough cases, and of course that is to be expected, but we're also seeing them in vaccinated populations under very, very tight restrictions, like inside the Olympic Village, like we just talked about, or inside the White House. This becomes very surprising to people out there, but is it also surprising to health professionals?
I don't think it is surprising because we do know that the Delta variant is more contagious. And we also know that these breakthrough infections in double dose people who've had double doses or are fully vaccinated are also happening in places where there are a high number of cases in the community. The transmission levels overall are high. So this would predicate or really help the virus infect even people who have been vaccinated, because as we know, Delta has chipped away at that efficacy of the vaccine. But the key information that I think most viewers who are maybe a bit concerned is that it'll still prevent the most severe symptoms or hospitalizations. So what we're seeing in terms of the people who are most likely to die of COVID, they remain within the unvaccinated population. However, the concern is around a continual transmission, as you say.
Yeah, and so there is a risk as data comes out that people out there see these breakthrough infections and they feel like, oh, the vaccines aren't working. How do governments continue to communicate to people that, no, it's still better to be vaccinated than not?
Well, certainly, again, the numbers speak for themselves. When we look at the cases of patients who go on to be hospitalized, who have poor morbidity outcomes, this is all related to primarily the vaccination status. Again, there are in some cases individuals who are particularly frail or elderly who have had double doses and have passed, but this is statistically a small number. So I think those headlines need to be balanced with the fact that overall we are still protected. But at the same time, just because we have vaccines, it doesn't mean that this should be a total free-for-all. Most of the world still has very low vaccination rate. We know that this helps to develop variants, and now we also have to think about whether booster doses will be needed as a result of waning vaccine immunity or efficacy, as we're currently seeing.
And the numbers that do come out of research, they change the story day to day. We see sort of shifting knowledge and experience based on, what people out there have experienced when they have the virus. So while we do see the serious infection numbers going down, we see the hospitalizations and deaths not even coming close to what we saw in the first wave and the second wave, and that's thanks to vaccinations. There is some surprise at how the vaccines have not prevented reinfection. Isn't that right? I've heard that among doctors, that they expected the vaccines to do a little bit better in preventing people from getting COVID again.
Well, certainly, I think that depending on which vaccine we're looking at, there are varying levels of protection as well. And reinfection is certainly something that people are, for instance, particularly if you only have one dose of vaccine, and young people in particular are going to be more likely to be in that scenario, then we see that reinfection, even with one dose and previous levels of antibodies, there seems to be a higher level of protection from the vaccine than from natural protection.
Got it.
So it's interesting to see that some countries have taken forward a path of not vaccinating adolescents.
All right, Oksana Pyzik, thank you for your knowledge on this.